everyone, welcome back to my YouTube channel Medcode Education. In this video, we are going to discuss about CPC exam paper, question paper. Okay, more question paper. So let us discuss one by one. First section is related to medical terminology. Okay, medical terminology session. First question: what structure cushions and reduces friction between bones and joints? Okay, so here are the options cartilage, fascia, ligaments, tendons. The right answer is cartilage. Okay, so this is the correct answer. And second one, which one of the following records the electrical activity of muscle tissue in determining the strength of muscle contraction as the muscle is stimulated? So this question is related to electrical activity of muscles. It's the right answer is electromyography. So, this is the instrument used to record the electrical activities of muscle tissue. And third one, urticaria is commonly called what? Hives. Okay. Another name of hives is urticaria. And fourth one is what is done when a surgeon performs a bilateral oophorectomy? It's a most important question and the repeated one. Okay, bilateral means it's both. Okay, bilateral means both. Oophorectomy means it's a ectomy means removal. Ectomy means removal. Okay, so oophorectomy means removal of both ovaries. Okay, removal of both ovaries. Clear? And move on to anatomy section. The adrenal glands are found in which system? Okay, this is also most important question and most repeated question also. Okay, the adrenal glands are found in endocrine. Okay, endocrine system. It's completely related to endocrine. Hmm? And second one, which one is an organ of the lymphatic system? Lymphatic system organ, spleen. Okay, spleen is the correct answer. Also, and the other organs, vast differences, pancreas, pineal gland, spleen. So the correct answer is spleen. I remember this question because in my CPC examination, this question is also they mentioned. Most important. And next one is patient is going to have a placement of myringotomy. Okay, tube, myringotomy tube. This tube is placed in the dash to drain excess fluid. So here, what is myringotomy? Myringotomy means sorry. Myringotomy means it's completely related to ear. Okay, ear. Myringotomy tube is it is placed in the patient's ear. Okay, to drain excess fluid. Okay, then next one, fourth one is the dash carries urine from the bladder and travels through the prostate to the outside of the body. So, urethra carries the urine from the bladder. Okay, urethra carries the urine from the bladder and travel through the prostate of the outside of the body. Okay, carries urine from the bladder and travels to the outside of the body. Clear? And next one is complaints and regulatory section. So it's a direct question. In our CPT codebook are divided into 6 main section titles. Okay. If you have any doubts, do check it out. Take your CPT textbook and see the title page. These sections are organized in numeric order except for which category of codes. One category of codes is, it's different from others. Which category of codes? Their evaluation and management codes are entirely different from the 6 main section. Okay. Others are pathology, medicine, surgery, all are related to one section, but E and M or evaluation and managements are entirely different from those categories. Clear? Just note it down. And next one, which one of the following is commercially or private payer? Private payer means Blue Cross Blue Shield is the commercial or private payer. Okay. It's related to HIPAA. Okay, so note it down. And third one, which one of the following is a budget neutral program that provides single quality reporting system with a single payment adjustment factor based on individual or group performance in Medicare Part B? So, Medicare Part B, it is related to Part B. Okay. Budget neutral program. Okay, budget neutral program, single quality reporting with system with a single payment, single quality system with a single payment. Okay, so which factor based on individual or group performance in Medicare Part B? It is based on, MIPS. This is the right answer. MIPS, it means merit based incentive payment system. Okay, merit based incentive payment system. And note the point, I'm giving four options here: advanced alternative payment model, national coverage determination, local coverage determination. You have to understand what is the options and also know about the short form and long term of all the options. Okay, because each and every one is very important, but in this question they are asking about the merit based incentive payment system. Okay, you can expect in your question paper other options also. Okay, so try to understand the concept of option A, C, D. Okay, next is yes, coding guidelines related. So in this question, it's also a direct question, CPT coding guidelines related. Okay, here a description is provided. What is the correct code? Okay, mention the correct code. This is the question. Mm, Let us read the description first of all. Which CPT code include determination of the number of gestational sac and fetus, as well as qualitative assessment of amniotic fluid volume and examination of the maternal uterus and adnexa? In your examination, this type of questions are very important. Okay, so you have to try to take fastly every code. Okay, first of all, check 76805. This is the option A. So take 76805 and read clearly. Next, move on to next code, read clearly, and next. Okay, so speed is very important. Take the code fastly. Okay, because the direct questions. So second one, according to CPT coding guideline of obstetrical ultrasound, which code represent a quick look exam? It's also a direct question from in your textbook. Quick look examination is completely related to 76815 code. Okay, quick look. Hmm? Take the code in your CPT textbook and read the description of the code. Okay, and next one. A therapeutic colonoscopy is performed where the scope goes beyond the splenic flexure but not to the cesium. Using the colonoscopy decision tree illustrated in the CPT code book, what coding is reported? What coding is reported? Um, you know, 45331, comma 45347. Okay, 45331, comma 45347. Next is it is related to true statement, true or false related. Okay, which statement is true? This is the question. So here four statements are the options. So read the statements carefully and try to answer the question. Okay, so it is related to lesion excision. Okay, so take your CPT textbook and take lesion excision page. Then you have to read the options one by one. Okay. Lesion excision code include removal of a lesion with margins and simple or non-layered closure when performed. This is the right or a true statement. Others are, it's a wrong statement, because here they have mentioned it's a removal of a lesion, margins also here, and they have mentioned simple closure when performed. Okay. Option B, look at the option B. The option B is saying complex closure when performed. That's not a true statement. Okay. Mm, and also, third, they're asking something, you know, not a logical statement. So, in this type of questions are arriving, you have to take the appropriate page number in your CPT textbook. After that, you have to read the options one by one, then decide the correct answer. Next is ICD 10CM code book related. NOS. Okay, not true about the abbreviation. So it signifies not true. Okay, not true. Okay, so we want the false answer. Okay, here not true they have mentioned. So take the false answer. It signifies that even though the medical record is specific, the condition is not elsewhere classifiable. Okay, so this is the correct answer. Clear, guys? Next, also CPT guideline related, which scenario best represent the correct use of modifier 78? Modifier 78. So take modifiers page number. Modifier 78. Read the description of modifier 78, and you have to, take the appropriate answer in the above statements. Clear? So here the correct answer is patient had an open inguinal hernia repaired 2 weeks ago. He is in the doctor's office because the surgical wound is bleeding. The physician cleans the wound and applies wound adhesive to reclose a small opening. Hmm? So this is the correct statements that related to the modifier 78. Mm, okay. According to the seventh one, according to the application of cast and strapping CPT guidelines, what is reported when an orthopedic provider performs initial fracture care treatment for a closed scaphoid fracture of the wrist, applies a short arm cast, and the patient will be returning for subsequent fracture care. So here the option 25622. Okay, cast and strapping related guideline. Next, move on to ICD 10CM. Uh, an elderly patient comes into the emergency department ED with shortness of breath. An ECG is performed. Okay, I just noticed it. Kirti Nakella. I think third question answer is 45378. Third question. Okay, just a second here. Mm, 45378 modified 53. Splenic flexure. Okay. No, dear. The correct answer is 45331 and 45347. Okay. We'll check it out once again. Okay. In ICD, it's emergency. Okay, so an elderly patient comes into the emergency department (ED) with shortness of breath, and ECG is performed. The final diagnosis at discharge is impending myocardial infarction. According to ICD 10 guidelines, how is this reported? So, you know, the final diagnosis at discharge is myocardial infarction. Clear? The patient comes into the emergency department first of all. He have shortness of breath. Okay, but ECG is performed. The correct answer means the correct diagnosis or the final diagnosis. Physician identified that myocardial infarction. Okay, so what is the guideline? How it is reported? You know, um, final diagnosis, the most important diagnosis will report it. I20.0 is the correct answer. Okay, I20.0. Next is second question. It is related to type 1 diabetes mellitus. Okay, a 58-year-old with type 1 diabetes mellitus comes in for comprehensive eye examination. She is diagnosed with non-proliferative diabetic retinopathy with macular edema in one of her eyes. What the ICD 10 code is reported. So here, the correct answer, it's a E series of E section. E10.311 is the correct answer. Here they have mentioned type 1 diabetic mellitus with unspecified diabetic retinopathy. Okay, here uh, not mention the specific. Okay, in this question they are not specified the correct location. Okay, one of her eyes. Okay, they have mentioned only macular edema in one of her eyes only. Okay, not mentioned right eyes or left eyes. So unspecified site. Okay, so that is why the correct answer is E10.31, because E10.31 explaining the type 1 diabetes mellitus with the unspecified diabetic retinopathy with macular edema. Correct, clear answer is here. Okay, and next is it is related to S related category. So, uh, you guys are ready to attend the CPC examination. This type of ICD 10 codes are most repeated. Okay, this type. First of all, I series they have in your question paper. I series are there, and E series, S series also there, Z series. So these are the most important series they have asking. Okay, so you have to expect more ICD questions, this kind of questions. Okay, basically, I have already uploaded a video related to CPC examination, all about CPC examination clearly. If you are not watched the video, do check it out. Uh, Here, ICT Tensium is about 5 marks questions. Okay, CPT is mostly 80 percentage of questions are in CPT, and 5 marks of questions are in ICD section. Okay, so you have to concentrate in CPT because 80 percentage of questions are in the CPT session. So you have to pass, or you will get a better score only after you have to understand the CPT book clearly. All the guidelines and all the codes, you have to familiar with more codes, and you have to practice well in CPT section. After that, you have to study the ICT session. Okay, because it is just a 5 marks. Okay, but 80 percentage of questions in CPT session, so you have to concentrate more in CPT. Okay, I prefer all the students to concentrate only in CPT session. Okay, so here S series of code, third one. The correct answer is option A. Okay, do check it out, guys. I'm not explaining the entire description. If you are just take your textbook and take the codes and evaluate the things. Okay, And if you have any doubts or queries related to this question paper, more questions, or in any specific topics, directly mail me, or directly contact me, midcodeeducation10@gmail.com. This is my mail ID. Okay. Uh, Fourth one, it's Z series. You know, Z series is also it's a follow-up examination. Medical history related things are in Z series. Okay. So, a patient had stomach polyps removed on previous copy. The patient returns 1 year later for a follow-up examination for another esophagogastroduodenoscopy. Okay, little bit long. No new stomach polyps are seen. What diagnosis codes are reported for the second esophagogastroduodenoscopy? Okay, so is it 09.9 comma is at 87.19. Okay, it's not a full stop, it's a comma. Okay, just mistaken. And next is O series of code. What is the speciality of O series of codes? It is completely related to pregnant ladies. Okay, O series of codes is represent the pregnancy. A 27-year-old pregnant with twins goes into labor at 34 weeks gestation. Fetuses 1 is delivered vaginally, fetus 2 is in breech position, and a cesarean section is performed for delivering this baby. Both babies are healthy, applying ICD-10-CM guidelines. What ICD-10-CM codes are reported on the maternal record? So these are the conditions. These are the conditions. Okay. So here, a pregnant lady with twins. Okay. 34-week gestation have mentioned, and one fetus is delivered vaginally, and next fetus is cesarean. Okay, so here both sections are attended the lady, vaginal delivery also and cesarean also. Okay, so here uh, you have to put more attention to which one, vaginally or cesarean, which is more difficult. You know, cesarean is some difficult. Just a second, yes. Yes. Okay. So here also, most difficult one is coded first of all. So we discussed here the lady goes vaginal delivery and cesarean also, breech position and the cesarean section. So most important is breech position and the cesarean section. So you have to code first of all the fetus 2. Okay, fetus 2. Clear. And next is my favorite section, CBT. 10K series. It's a small question. A 55-year-old male is seen for a hairline transplant. A total of 20 punch graft were transferred to the recipient site. What CPT then reported? So direct question. Take your textbook 15776. Look at the 15776 code. So this is the correct answer for this question. No need to explain the number of punch graft. See the option D, 15776 also correct answer, but into 2 they have 20, they have mentioned 20 means they noted that 20 punch graft. Okay, no need to code this 20. Only 15776 is enough. Okay. And the next question is the surgical preparation of a 25 square centimeter wound on the sorry, right leg. Okay, little bit mistaken. Right leg is performed along with the 25 square centimeter wound on the left leg. What CPT code is reported? Correct answer 15002 is the correct answer. No need to code both the leg. Okay, look at this option A. Then 15002 is correct, but they have mentioned both two. Okay, into it. No need to code two, just only the code 15002 is enough. Some little bit mistaken are in the options. Okay, so carefully read the options. Only after that you have to code the appropriate one. Clear? Third one, patient present with pressure ulcer of both lower extremities. The doctor debrides a 25 square centimeter ulcer of the right calf to the bone. A 10 square centimeter ulcer of the right heel is debrided subcutaneously, and 15 square centimeter ulcer of the left heel is debrided subcutaneously. Totally 25 square centimeter. Code all services. So all the services we have to code all the services. Okay. So here, uh, check the code one by one. 11044 is first code. 11047 is next. 11042 modify 59 also. 11045 modify 59 also. So each and every service have to code. Note down, guys. Next is a patient presence with a draining inflamed area at the base of the tailbone. The physician diagnoses a pilodial cyst and performs an incision and drainage that require extensive packing with gauge. What CPT code is reported? Mm. So 10081 is the correct answer. Mm. This is for the pilodial cyst and perform an incision and drainage. Mm. Okay. Mm, yes. Fifth one, it's a little bit too long question, but the option is very small. Okay. During her annual physical exam, a mass was found in the upper outer quadrant of the patient's right breast. Okay. She is scheduled today for a breast biopsy. An 8 gauge vacuum assisted biopsy needle was advanced into the mass under sonographic guidance, and one core was taken from the mass. A clip was placed. A sonographic image after clip placement shows the clip in the lesion. The biopsy is to pathology to rule out cancer. This is the question. Here also, CPT codes are there and ICD 10 codes are there. So try to report the correct codes. First of all, you have to report the services. Services means 19083 is the correct answer. What services they have done? The physician done which type of services? Breast biopsy. Clear. So breast biopsy was done by the physician with the help of uh, under sonographic guidance. Okay. And next is N63.11. N63.11. N63.11 is for mm, condition. Okay, patient's condition. Clear? 6.1. A physician excises a 3.5 centimeter malignant lesion, including margins from the back, then destruction of a 2.0 centimeter benign lesion on the right cheek of the face with cryosurgery. What CBT and ICD-10 CM is reported. So here 11604 C44. So yeah, physician excises first of all 3.5 centimeter malignant lesion margin from the back side. Then cryosurgery at the right cheek of the face. Okay, there are two surgery related procedure done, and also mm, yes, okay, then destructions of right malignant lesion of the upper back. Okay, correct. Okay, so there are two procedures they have done. So try to read the options carefully. Little tip giving you guys, because before reading the question, just read the options first of all in your examination only. Okay, in your CPC examination, and just read the option first of all. You have an idea about which category of codes they have mentioned. Okay, so easily take the code in your textbook, then read the question. Clear? So you will get an idea about the section, and you will get fastly the code. Okay, no need to search for the options, entire options. So take a most common option first of all, then try to read the description. Mm. Practice make you perfect, guys. Practice well. Okay, 20K series. Next is 20K series. A 42-year-old with medial epicondylitis is scheduled to receive an injection at the provider's office. The area of maximal tenderness is palpated and a needle is introduced under ultrasonic guidance, injecting the cortisone. Permanent recording and reporting are in record. What CPT code is reported to the surgical procedure? So, here, mm, what is the procedure? Surgical procedure. Okay. Also, they have mentioned ultrasound guidance. So, just to check the option C 20606 LT left. Okay, so it already in the particular codes they have mentioned the ultrasound guidance. No need to add. No need to report extra ultrasound guidance. Okay, in one code always contain the ultrasound guidance, so no need to code extra. And next question. Kathy broke her wrist while on a hiking trip, and gauntlet cast was applied by the local ear physician. She goes to her primary care provider 1 month later to have the cast removed. What CPT code is reported for the primary care provider? The correct answer is 29705. I'm bolding the correct answer in my screen. I think everybody can see my screen, so it will help you to screenshot. And also, this video is in my playlist. So, if you have any queries or any doubts, do check it out, guys. Okay. And once again, I am introducing my mail ID, medical coding midcodeeducation10 at gmail.com. So directly message me If you have any queries, any doubts, I will reply. Okay. I know some students they are messaging me, and also I'm replying. And also some comments are here in our YouTube channel. Also, I'm replying. So if you want any help related to medical coding, no issues. I'm ready to help you. Directly message me, guys. Okay. And also thank you for your support. We got one more K subscribers. I'm so much happy. I'm so much excited to announce this because you are guys making my you are very special for me. uh your support, your 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 attention make me happy. Thank you guys once again. Thank you so much. Okay. Third one, an elderly patient returned to the surgical suite from the ER after a fall from standing height. It's a too much big question. I'm not describing this. I'm not reading the entire question. You guys just read down. Here also, it's a mixing of combination of CPT and ICD codes. Okay, first of all, in 27248. Right. So I'm giving a little tip for you. Here, the question mentioned right femur. Right femur. Okay, so right femur is the a patient affected right femur. So just look at the options first of all. Okay, R1 not a logical option. Skip that and look at three options. So just eliminate the option A. Then B, C, D. Look at this. Also RT, RT, RT. RT is correct answer because right. Correct. And then look at the both the options. B and C represent same code. So take 27248 and 27246. Look at these codes, then finalize the correct answer. You will get an idea about that. Okay. If you have any doubts in that first code, just eliminate these codes. Take the second one or take the last one. Clear? This is the trick for identifying the correct option in order. Okay. Read, read, read. Next is yeah, it is related to CPT also, but here one special code is there, you know, 0165T. Check your textbook. In your textbook, last section is describe the 0165T related, or series related. Look at that options. Okay. Mm, Here easily you can identify the thing because A and D options are same. First codes are same. So take 22862 in your textbook. Read the description, then finalize the correct answer. Two or more options, uh, one or two options are similar. Check the code first of all. Okay, because the correct answer is hiding hidden in that two codes. That one of the code. Okay. Next is fifth one. Mm, Also compression fracture related L2, L3 and L4 vertebrae. The patient agrees to have kyphoplasty. Kyphoplasty and a balloon catheter is inserted in the vertebrae and inflated, restoring the height of the vertebra. Bond cement is injected in the vertebral space until the whole L4 body is filled. The same procedure is performed on the L2 and L3. The procedure is performed bilaterally on the three vertebrae. So, what is the CPD codes is reporting? Here are the options, guys. 22514, 22512. 515 into 2 is the correct answer. Okay. Okay, guys, I'm stopping this live video now, but I will be back on next video. Okay. So see you in the next